Now, okay, so this will take 15 seconds for it to come through. Does it still sound bad though? Oh no. Yeah, wait for it to be, yeah. Wait, why are we hearing me right now?
This is a different stuff. There's now a bogus.
Yeah, I was gonna ask Daniel, but he's disappeared on us. Okay, Daniel's doing it. All right, hi everyone, and welcome. Shabbat Shalom. Sorry, little tech problems today. We're figuring it out, one technology at a time. And we're gonna have Daniel light candles. That's on page 120 if you want to follow along. I thought you were pointing to Aaliyah. You're pointing to Ash? Uh-oh, Ash looks terrified.
We can do this. I'd rather have my turbo.
You want this one?
Okay. Do you want to read that paragraph? What's up?
I'll just stand here.
Okay.
I don't know what I'm doing.
Okay. Baruch atah Adonai Eloheinu melech haolam asher keshanu b'tzmotavu. Not doing it to them. V'tzivanu lahad lekner shal. Thank you.
Beautiful, thank you.
As these Shabbat candles give light to all who behold them, so may we, by our lives, give light to all who behold us. As their brightness reminds us of the generations of Israel who have kindled light, so may we, in our own day, be among those who kindle light. Thank you.
All right, we're moving over to page 128. Hine ma tovu manaim shevet achim gam yachad. Hine ma tovu manaim shevet achot gam yachad. Hine ma tov shevet achim gam yachad. Hine ma tov shevet achyot gam yachad. Hine ma tovu manaim shevet achim gam yachad. We now turn to Lachado D, which you can find on page 138 of your prayer books. And then tonight we're going to recite paragraphs 1, 5, and 9. When we arrive on paragraph 9, we invite you all to stand up and look towards the entrance as we greet the Shabbat bride. Lecha dodi likrat kala, pnei Shabbat nekabela. 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 Shamor v'zachor b'dibor echad, Hishmi'anu el hamuchad, Adonai echad u'shmo echad, Leshem lefeteret ve'letila, Lechadodi likrat kalam, Panei Shabbat nekabela, Lechadodi likrat kala, Panei Shabbat nekabela, Hitoreri, Kiva ore kumi ori, uri shir daberi, Kivod Adonai alek negilah, Lechadodi likra kala, Panei Shabbat nekabela, Lechadodi likra kala, Panei Shabbat nekabela. Please rise. Boi v'shalom ateret ba'a, Gam bismicha uvtzolam, Toch emunei am segulam, Boi chala, Lechadodi likrat kala, Panei Shabbat nekabela, Lechadodi likrat kala, Panei Shabbat nekabela, Lechadodi likrat kala, Panei Shabbat nekabela, Lechadodi likra kala, Panei Shabbat nekabela. You may be seated. We're now moving to Shalom Aleichem on page 142 of your prayer books. Shalom Aleichem, Malachei Hasharet, Malachei Elyon, Mi Melech, Malachei Hamlachim, HaKadosh Baruch Hu. Boechem l'shalom, Malachei Hashalom, Malachei Elyon. Mi Melech Malachei Hamlachim, HaKadosh Baruch Hu. Baruchuni l'shalom, Malachei Hashalom, Malachei Elyon. Mi Melech Malachei Hamlachim, HaKadosh Baruch Hu. Seichem l'shalom, Malachei Hashalom, Malachei Elyon. Mi Melech Malachei Hamlachim, HaKadosh Baruch Hu. Now turn the page to 144 for the Chatzi Kaddish. Yitkedal v'yitkeda shemei Rabba, B'ilma divrach yotev yamlik malchutei, B'chayechon uv'yomechon, uv'chayei dechol beit Yisrael, Ba'agala, uv'izman kariv, v'imaru, amen. Yehei shmei Rabba mevarach, le'alam elal me'almaya, yitbarach ve'yishtabach, ve'yipa'ar ve'yipromam ve'yitnaseh, ve'yitadar ve'yitale ve'yitalal, shemei dekudashah b'richu, le'elam min kol berchata v'shirata, tushbechata v'nechemata, da'al miran be'alma, V'imaru. Amen. Turn to page 146, and I invite you to rise for the Baruch Hu. La 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 la. La 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 la. La 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 la. La 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 la. La 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 la. La 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 la. Baruch Hu et Adonai HaMevorach. Baruch Adonai HaMevorach. HaMevorach Le'olam Va'ed. HaMevorach. HaMevorach Le'olam Va'ed. You may be seated. Let's read together in the English on the bottom part of 149. This is an hour of change. Within it we stand uncertain on the border of light. Shall we draw back or cross over? And where shall our hearts turn? Shall we draw back, my brother, my sister, or cross over? This is the hour of change, and within it we stand quietly on the border of light. What lies before us? Shall we draw back, my brother, my sister, or cross over? Baruch atah Adonai hamariv aravim. Let's continue in the English on the bottom part of 151 together. Wisdom and wonder, passion, instruction, story and symbol, all these things your Torah give to us. And the more we devote ourselves to it, the more it grows and gives. What could be a truer token of your abiding love than this of holiest of your works in the living language that gives it form? Baruch atah Adonai ohev amo Yisrael. We now move into the Shema on page 152. Shema Yisrael Adonai Eloheinu Adonai Echad. Baruch Shem Kevod Malechuto Leolam Avad. Move over one page to 154. V'ahavta et Adonai Elohecha b'chol avacha u'b'chol nafshecha u'b'chol meyodecha v'hayu hadevarim ha'ele asher anochi mitzavecha hayom al levavecha v'shinartam levarnecha b'divarta ba'am b'shivtecha b'veitecha uvatecha havaderech ushofbecha uvkumecha ukshartam leyot al yadecha v'hayu letotafot beineinecha uktavtam al mizuzot beitecha uvisharecha l'ma'an tizkeru v'asitem et chol mitzvotai v'tim kedoshim le'elohechem ani Adonai Elohechem asher hotzeti etchem meretz Mitzrayim liot lachem le'elohim ani Adonai Elohechem Adonai Elohechem emet. Moving over to 158.
From this week's parsha.
Oh, is it really? Nice. Here we go. Lie, 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 mi chamocha ba'alim Adonai, mi chamocha Ne'edar ba'kodesh, Nora tehilot osei fele, Nora tehilot osei fele, Lai 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 lai. Moving over to Vishamru on page 162. Vishamru b'nei Yisrael et ha-Shabbat, lasot et ha-Shabbat ledorotam berit olam. Vishamru b'nei Yisrael et ha-Shabbat, lasot et ha-Shabbat ledorotam berit olam. B'nei Uvein, B'nei Yisrael, Oti le'olam. V'shamru B'nei Yisrael et ha-Shabbat, lasot et ha-Shabbat ledorotam berit olam. Ki shechet yamim asa Adonai et ha-shamayim ve'et ha'aretz v'shamru v'nei Yisrael et ha-Shabbat lasot et ha-Shabbat ledorotam berit olam. Ubayom hashvi'i Shabbat vayinafash, Shabbat vayinafash, Shabbat vayinafash, v'shamru v'nei Yisrael et ha-Shabbat, lasot et ha-Shabbat ledorotim berit olam. Now move to page 164 of your prayer books, and when you arrive there, I invite you to stand with me. Adonai sefatai tiftach u'v'yagita ilatecha. Adonai sefatai tiftach u'v'yagita ilatecha. Baruch atah Adonai Eloheinu v'Elohei Avoteinu v'Imoteinu, Elohei Abraham, Elohei Yitzchak, Elohei Yaakov, Elohei Sarah, Elohei Rivka, Elohei Rachel, Elohei Leah, Ha'el Hagadol v'Hagibor v'Hanobra, El Elyon, Gomel Chasadim Tovim, V'Konei Hakol, V'Zocher Chastei Avot v'Imahot, U'Mevi Geula Livnei B'neihem, L'man Shemo B'Yahava, Melech Ozer Moshiach U'Magen, Baruch atah Adonai, Magen Avraham, Ezra Saram. Atah Gibor Le'olam Adonai, Mechayeh Kol atah Rav Li'Yoshia, Mashiv HaRuach U'Marid HaGashem, Mechakel Chayim Bechesed, Mechayeh HaKol Berachamim Rabbi, Zomech Noflim Verofei Cholim, U'Matir Asurim, U'Mekayem Emunato, Lishanei Afar, Michamocha Ba'al Gevurot, U'Midom Elach, Melech Mebit, U'Mechayeh, U'Matmir Yeshua, B'ne'eman atah lechayot hakol, Baruch atah Adonai, Mechayeh hakol. We will now now continue silently until page 180, and you may be seated whenever you like. Oh, say shalom bimromav, huya say shalom aleinu, ve'yakol Yisrael, vimru, amen. Oh, say shalom bimromav, Huya say shalom aleinu, ve'yakol Yisrael, vimru, amen. Yaseh shalom, shalom aleinu, v'yakol Yisrael. 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 All right, well, I'm honored to invite Jesse and Ashley up here. They work for the state, and they're going to show us a little bit about what's going on with chronic disease here and how they're addressing it through their program called Fresh Start. So I'm going to have to get the kind of the thing going here. Give me a few moments for that. It's its own technological marvel. But thank you for being here. We appreciate you coming and telling us about this important subject. We're not scared.
Well, I guess while we're waiting for the tech side, we can just get started introducing ourselves. My name is Ashley Manai. That's my daughter, Lena. Sorry, don't mind her. We have my son Logan and my daughter Lena are out there. We have their Logan's winter ball for his school at 7 o'clock tonight. So I brought them with me. We're heading straight there, and they're very excited. So they're quite energetic. They're playing with Asher right now. Anyway, so I was born and raised here in Anchorage, grew up here, left for college and grad school, and finally made my way back just in time for the pandemic lockdown. So moved back literally like a few months before the world shut down, but thankfully I made it back here before that. So anyway, I'm really excited to be with you guys tonight, and thanks so much for having us.
I'm Jessie Downs. I'm the nurse consultant in the section of chronic disease prevention and health promotion. So I get to do, I think I have the coolest job in the entire department. I get to do a lot of the work with our healthcare systems in figuring out ways to implement public health practices into clinical medicine. And I've been in Alaska since about 2008, which is probably about when I met Susan 1,000 years ago when you had a tiny, tiny baby and not this grown adult sitting next to you. Oh my gosh. But I've had a chance to work with both tribal health and public health for most of my career living here in Alaska in different ways.
I guess I should tell you what I actually do as well. I'm the program manager for the Heart Disease and Stroke Prevention Program in the state of Alaska Department of Health. Clicker. Awesome. Which one do I? Okay.
I don't know. Just figured you just play. Wasn't even a moment ago. No, it's just sticking out right there. Do we need a button? I did a whole dry run this morning, y'all. That's why. Do we need a button monkey? You might. Is it not working now? Here, try it here. Let's try this.
What did you?
I don't know. There's a certain spot you have to aim it at. That's how light goes on. There it is.
Okay.
We'll make that so hard with one slide. I've used this flawlessly before in the past.
Oh, it just.
As you give up all hope, that's it.
Okay,
I promise you this morning was working flawlessly.
I'll just keep pressing buttons until something happens. Okay, so okay, I'm just gonna stand here and not move my hand. Okay, so we always like to start out all of our talks with a land acknowledgement. Want to acknowledge and thank and be appreciative of the fact that we do live and work on Dena'ina land, and that we are really grateful for the Dena'ina and Athabascan people's stewardship and generations of indigenous Native Alaskans created the Alaska that sustains us today, and it is our hope that our public health work supports everyone's ability to thrive in their traditional homeland. So, okay, quick introduction to our teams. I'm gonna just like try not to move anyway. If I don't move my hand, it'll work. And I'm not moving? Okay, oh, there we go, okay. So this is a kind of very glossed over synopsis of how our team structure is. And we always try to put something similar to this in our presentations because most people who don't work for the state don't really understand how we're structured. And honestly, I have been working in the state for a while and I still am learning how we're structured. So we are housed within the Department of Health, then the Division of Public Health, and within the section for chronic disease prevention and health promotion. And you probably can't read all of those right now, but that top, the 1, 2, 3, 4th layer down are all of our teams within the section for chronic disease. And then Jessie and I are both housed within the health systems collaboration unit. And that's where we have our heart program, diabetes program, cancer program, dementia program, and Jessie works with all 4 of our programs. So broadly speaking, the section for chronic disease prevention and health promotion, we work to prevent and address chronic disease and injury so that Alaskans can live longer and healthier lives. And specifically looking at our team, the Health Systems Collaboration Unit, We are very program-centered. We work very closely with, like our name says, health systems throughout the state. We have approximately 2.5 million in annual funding. I think we're actually a little bit over that right now. We have 20 plus contracts with different entities throughout the state and throughout the country. And broadly speaking, our programs share support positions for, we really support cost efficiencies, maximizing collaborations around the state. And we have a lot of projects and contracts and different endeavors that kind of bind all of our programs together, really working to look at that big picture of health throughout the state and working to prevent and reduce the burden of chronic disease. And so we have a lot of overlap in braiding our funding sources and our work. Okay. So our main, our kind of cross-unit themes, broadly, our mission within our unit is to lessen the burden of chronic disease, and we work to do that by eliminating barriers and then improving the use and the quality of existing systems throughout the state. So we have three kind of layers of work that we do within our team. We work to empower Alaskans for individual wellness. We work to connect Alaskans to their health systems, which you would be amazed at how many Alaskans are not connected into their health systems, and they just don't have a means to really utilize the health systems that we work so hard to provide. And then improving the currently existing health systems and the care systems around the state so that they get stronger and better. Pressing the button. So as I mentioned before, we our programs, our unit, our team in general, we're very program focused, and we do a lot of collaborations throughout the state. I'm not going to read every one of these, but this is just to give you an idea of just current projects and kind of contracts and collaborations that we have around with different partners throughout the state. And we are always changing these, expanding these, bringing on new collaborations. Sometimes we end collaborations once we get things up and running and we establish sustainability without our involvement, where different folks that we're working with or groups that we're working with are able to carry on without our support. That's really the ultimate goal, is to support and fund and get different things to a place where they are sustainable without us having to hold them up as well. So this is just an example of some of the partners that we're working with throughout the state. And this includes like community based organizations, as well as some of the larger ones like ANTHC and Search and all that. So Rabbi Abram asked me to give, first of all, kind of an introduction of who we are and how we work and where we are within the state and what we do. And then also to give you kind of a foundational understanding of some of the data that we look at and what we do with that data, like where we pull it from, what we do with it, and how we work with it. So just thanks for being patient. So kind of a brief, actually, I'm gonna pull out my notes for this one. So a brief synopsis of some of the data that we look at. We have a lot of data sources that are both statewide and national. We have access to a lot of data sources and number crunching, software and things like that from the CDC as well. But within our state, one of our biggest sources of data that we rely on is, we call it BRFIS, which is a terrible name, sounds terrible, but it stands for Behavioral Risk Factor Surveillance System. So BRFIS is actually a surveillance system that exists in all 50 states, and it's supported and guided by the CDC, so that it's somewhat standardized within a certain scope throughout the country. And it's used to report prevalence estimates of adult health risk behaviors, preventive health practices, and health status. So the data is collected annually through random digit dialing, and then it uses dual sample framing. So basically what that means is that this is a survey that's done over the phone. So that does have some inherent bias that's involved with it, but this is one of the best and most reliable and consistent sources of data that we have for health behaviors, chronic disease, health burden, and all of the things that we work with a lot throughout the state. So it asks adults about their health and behaviors and what could affect their health. And we are always evolving these questions and kind of changing them nationally and statewide as well. So this year we've actually started including questions about something called social determinants of health. If you work in healthcare or public health, you're familiar with this concept of that there is more to health than just health. People's housing, their access to food, their access to safe, dry housing, their access to transportation, their ability to communicate, all of these things impact if and how they interact with their health system. Some of the other sources of data that we look at are for burden and mortality data, we look at HAVRS, which is the Alaska Health Analytics and Vital Records, the Youth Risk Behavior Surveys. We have landscape assessments which are basically just kind of like gathering information about what exists and what's happening around the state. We do some of these ourselves, other teams do some of these, and then we're able to get information from them. And then we have a lot of prevention and management program participation data that we get specifically from programs that we work with, that we support. Some of these are vendors that we contract with, and some of these are programs throughout the state that we provide technical assistance to. One of the things that has come up in some discussions is questions about why is the data that you all report on so delayed? Like, why does it take so long for us to get data? Why are you telling me about things that happened 2 years ago? Why do I care about this? So this is a slide that we have put in talking about just a really, really broad, like 30,000 foot level overview of why it takes so long to get data. And this is just an example for BRFIS, but other surveys and other surveillance systems are similar. The staff that we have that oversee BRFIS are actively juggling 3 years concurrently, and they are 2 years from survey development it takes 2 years to go from survey development to the final data actually being presented. And that's because of all the steps that it takes to actually develop the survey, implement it, and then look at the numbers, weight it based on things like demographics, age, geography, all these types of things, and actually make it reliable. And so the process of processing the data from the previous year, collecting the data from the current year, and planning the survey for the next year is all going on at the same time. If you're interested in learning more about this or just diving into this yourself, you can actually go and dive into the epicenter data which is where all of the BRFIS data for Alaska exists. And we support this epicenter website through a partnership with Alaska Native Tribal Health Consortium. So the data is a collaborative endeavor. And if you are interested, you can go to that website right there and play around with it all yourself. It's actually pretty user-friendly, and it is really, like, if you're a nerd for numbers, this is kind of fun actually to go into it. So, and feel free to, all of our contact information is at the end of this presentation. If you go to this website and you're kind of like going into the data and you have questions, there's contact information on that website, and also you can reach out to us and we're happy to answer questions for you. But there's some really interesting stuff in there. So if you're ever bored on a Friday evening and want to just look at numbers, I highly recommend it. Okay, kind of the state of chronic disease in Alaska. I'm going to do the first few slides here and then hand it over to Jesse. So this is a list of the top 10 causes of deaths in Alaska. And the kind of, I was going to say funny thing, but I guess it's not so funny. But the thing that I wanted to highlight here is that all of those green lines there are programs within our section. So our section for chronic disease prevention and health promotion, we have a lot of work because our programs that we oversee carry a lot of the burden in our state. A lot of deaths come from things that we are working to reduce the burden of. So 3 out of every 4 Alaskan adults has at least one underlying condition. 2 out of 3 Alaskan adults have overweight or obesity. 1 out of 3 of Alaska adults have high blood pressure, and 27% have high cholesterol. And these are some of the biggest indicators of chronic disease burden in our state. And I won't read all of the fine text here, but I put this up here really to show how interconnected all of these things are. Chronic disease is not, you know, it's very rare that someone goes into their doctor's office and just has high blood pressure, or just has elevated A1Cs, or you know, all of these things are connected. Our health is very holistic. There is a lot that is connected within itself, right? And our diet, our physical activity, our mental health, all of these things impact each other. So that's one of the reasons why we work so hard within our section to work really closely with each other and collaborate as much as we can, bring our funding together, bring our grants together, and bring our partners together as well. I don't know if this is gonna go. Okay, Rabbi Abram asked us to talk a little bit about what the pandemic did to these numbers. And as I'm sure you're probably not surprised to hear, nothing good. The pandemic did not help the state of chronic disease in Alaska. In June of 2020, Americans were gaining 1.5 pounds per month. And a year later, our numbers were showing us that 42% had gained an average of 29 pounds. 10% had gained more than 50 pounds, and people's sleep was awful, and sleep is a huge contributing factor to weight gain as well. Between 2020 and 2022, nearly 1 in 2 people delayed or canceled healthcare services, and nearly 10 million people missed, 10 million cancer screenings were missed in 2022 alone. So you can just imagine the downstream effects of how all of this impacted everyone's health. And with that lovely positive note, I'm gonna hand it over to Jesse.
Which button is it?
The down, yeah.
All right, so I'm going to jump in here and chat a little bit about specific chronic diseases. I actually sort of shared some general state of the state. I'm going to chat a little bit more about specific conditions that we put some effort and some focus into over the last few years. And the first is just diabetes and prediabetes. As you guys know, I'm sure, diabetes is the single most expensive medical condition any one individual can acquire over the course of their lifetime. And we know that within the state of Alaska, about 7.6% of Alaskans report having been diagnosed with diabetes. And this is BRFIS data. This is that survey that we were talking about. So we know that this is underreported. It's likely much higher. On that same survey, we found out that about 11% of Alaskan adults reported having been diagnosed with prediabetes. But what's interesting about that is that national data tells us that 9 out of 10 people who have prediabetes, which means that their blood sugars are elevated, they're beginning to develop an insulin resistance, but they haven't yet developed diabetes. 9 out of 10 people who have that do not know that they have it because it's generally symptom-free. So we can guess that 11% is actually probably significantly higher within the state of Alaska. So if you're hearing this and you're thinking to yourself, gosh, I wonder if I have prediabetes, or my family member, my spouse, my neighbor, my friend, feel free to either pop over to the CDC's prediabetes screen, or I had to watch a YouTube video to learn how to make this QR code. You can scan the code on your phone and it'll take you directly to a great interactive quiz that yourself or some of your family members or coworkers can take to see if you have or are at risk for prediabetes. This is just some data. When we look at prediabetes and diabetes within the state, the teal kind of colored bar on the top is prediabetes, and the dark blue bar below is diabetes diagnoses. And what I think is really striking as a public health professional when I look at this data is the absolute opposite relationship between Alaskans who have access to and are given screenings for prediabetes and those who go on to develop diabetes. That's because if you're screened for and identified as having prediabetes, that gives you access to resources. It gives you the wake-up call for some lifestyle change. You can get prescription pharmaceuticals to help kind of work with your body's insulin resistance and reverse that. Versus if you look down here at the bottom, the Alaskans who are most at risk for developing diabetes are those who are also those who've screening rates for prediabetes are the lowest. In fact, for our Native Hawaiian Pacific Island ethnicity, wasn't even high enough to hit our data. So this shows us that Alaskans who have access to and who have a good uptake in healthcare services are more likely to have access to prevention services that then prevent that prediabetes from going on to becoming diabetes. And we see the same split out by ethnicity and by region of the state. You can see that it's the same. And that tells us, again, that this could be an issue more associated with health behaviors and access to healthcare services than it is something unpreventable such as genetics or geography. Unlike diabetes, however, the stress. When we look at high cholesterol and heart disease, we don't see this split out by region. Rather, we see the same rates across the state, pretty much minimal variations between the two. So we know that this is a condition that all Alaskans could have access and services for. And then I just like to throw this map up here. I actually gave a presentation similar to this downstates, and I had to throw Alaska over the lower 48 just to show how big we are and make our Texas peers feel small. But this is how we split up the state in public health. These are the public health regions that we use when we're classifying different regions of the state. There's lots of different ways to split out the state: tribal regions, census tracts, zip codes. This is just how public health does it. All right, so all of that to say, what are we doing about it? So I'm here to chat about one of the many ways that we're working to intervene on behalf of chronic disease, a program that we call Fresh Start. So has anyone here in this room heard of Fresh Start before? How is our saturation levels? Oh, not bad, not bad. Good. Well, before I tell you all about it, I do always like to start my presentation with this picture, because that dashingly handsome man is actually my husband and my oldest son, Jonathan. With the exception of those two, every other picture that you're going to see from somebody in this campaign is actually somebody who participated in the campaign, found success from the programs, and came back to share about it with their fellow Alaskans. But when we were starting the campaign, it's probably no surprise to some of the ladies in the room that we were really struggling to get a man to participate, a man who had gone through the program and was willing to come back. So being the good wife and public health employee that I am, I suckered my husband